Welcome to the first of 8 webinars in the Project Firstline Infection Prevention Essentials series. My name is Christina Boyd, Director of Quality, Patient Safety, and Health Policy at the Illinois Health and Hospital Association.
Has joined the meeting.
As we are going through a handful of housekeeping items, we encourage you to please complete the poll that is open on your screen.
Has joined the meeting.
The results from this poll will only be seen by presenters and not shared with other participants on the line. Before we begin, I have a few announcements for you. First, due to the large number of participants on the line today, we will ask that you stay muted unless you are looking to speak. We will have a lot of opportunity and discussion during today's breakout session. So to take yourself off mute, you will click the unmute button at the bottom of your screen. For those that are not on WebEx and are only dialed in on the phone, you will hit *6 to unmute your line. We also encourage you to utilize the chat box in the bottom right-hand side of your screen. Finally, I want to make you aware that this webinar will be recorded. By attending this webinar, you are considered to have consented to being recorded. If you do not want to be recorded, please exit the webinar now. A copy of the slides and the recording of the webinar will be shared with all registrants following today's presentation and posted to the Chicago Department of Public Health Healthcare Associated Infections website. Again, I want to welcome all of you to the first of 8 webinars in the Project Firstline Infection Prevention Essentials webinar series. This series is intended for all frontline healthcare personnel, regardless of infection prevention training and educational background. These sessions will provide the foundational knowledge you will need to be able to confidently apply the infection prevention principles and protocols necessary to protect yourself, your facility, and your community. For this webinar series, we will be utilizing educational materials from Project Firstline, the Centers for Disease Control and Prevention's collaborative aim to provide infection prevention training. We appreciate all of the great work that you do to serve your patients and communities and look forward to connecting with you throughout this webinar series. Today's session is accredited by the state of Illinois for 0.5 hours of nurse continuing education credit. Only those attending the live program are eligible for continuing education. Following today's webinar, you will receive a survey via email, and you will need to complete all of the required fields in the survey, including entering your nursing license number, the time you joined the webinar, and the time you exited the webinar by Monday, May 2nd, in order to receive your continuing education credits. If there are multiple people in the room with you today, please be sure to share the survey link with those in attendance. Within 2 to 4 weeks following the close of the survey, respondents will receive their continuing education hours certificates from IHA staff. All participants in today's webinar will receive a certificate of attendance indicating your participation in today's session. The Illinois Health and Hospital Association is partnering with the Chicago Department of Public Health to host this webinar series in an effort to support your infection prevention training needs. You will be hearing from these team members throughout the webinar series. The Centers for Disease Control and Prevention Project Firstline initiative aims to provide infection prevention and control training for frontline healthcare workers by supporting their efforts to understand and confidently apply the infection prevention and control principles necessary to protect themselves, their facility, and their community from infectious disease threats. There are multiple components of this initiative, and goals of the project include, first, to conduct an infection prevention and control learning needs assessment, or you will hear us reference the LNA throughout the presentation. And that was conducted amongst frontline healthcare workers across the city of Chicago in an effort to identify their training needs and gaps. The second piece of this project is to promote awareness of the CDC Project Firstline Infection Prevention and Control Training Curriculum and to facilitate foundational infection prevention training using the CDC framework and for frontline healthcare workers across the city of Chicago. We know that many of you on the line today are seasoned infection preventionists or have had infection prevention training in the past. And you will no doubt find that the content throughout these educational sessions will be basic and truly geared towards building those foundational components for frontline healthcare workers. There will be opportunities for discussion during each one of our webinar series to hear more about the participants' experiences and to learn from their peers. We would welcome those with experience in infection control to share their knowledge and serve as mentors to those who are in the early stages of learning about infection prevention and control practices. Our third and final goal of this project is to evaluate these training sessions to ensure that they provide meaningful learning opportunities for frontline healthcare workers. So the first part of this project, as we have said, was that we were to distribute a learning needs assessment to help identify where infection prevention training gaps might lie, and then to use that information to develop meaningful education sessions to support our healthcare workers with implementing infection prevention recommendations. The Infection Prevention and Control Learning Needs Assessment was comprised of 49 questions intended to identify IPC training needs among frontline healthcare workers in the city of Chicago. The LNA was created as an electronic survey in REDCap, a secure web-based application for building and managing online surveys and databases. Respondents were provided with the option to answer the survey in English or in Spanish. The LNA was distributed via email to 425 people across 253 organizations in the city of Chicago, including acute care hospitals, dialysis facilities, mental health and behavioral health facilities, rehabilitation facilities, federally qualified health centers, home health agencies, hospice providers, long-term care facilities, skilled nursing facilities, urgent care centers, and other professional organizations and community partners that serve healthcare workers across the city of Chicago. Many of you on the line today may have even helped distribute and share the learning needs assessment with your own organizations. Please know that we appreciate your efforts and thank you for your collaboration in getting this information out to our frontline healthcare workers across the city. The next few slides will summarize some of the results from the learning needs assessment and the results that were utilized to assist us with planning this series. LNA survey responses were collected for a period of 7 weeks between November 4th, 2021 and December 22nd, 2021. During this time, 410 complete survey responses were received. That was 408 responses in English and 2 in Spanish. In terms of professional roles, a majority of survey respondents were registered nurses, healthcare administrators, non-clinical support staff, physicians, and infection preventionists. For the purpose of this summary, non-clinical support staff can be defined as activity aides, chaplains, receptionists, and other staff that provide clerical support to clinicians in various healthcare settings. While it is very small to see, the table on this slide summarizes the professional role of everyone that responded to the survey. In terms of healthcare facility types, a majority of responses were collected from acute care hospitals, nursing homes, outpatient facilities, dialysis facilities, and home health agencies. For the purpose of this summary, outpatient facilities include immediate and urgent care centers, federally qualified health centers, community-based clinics, medical offices, and infusion centers. Similarly to the last slide, The table you see here summarizes the different types of healthcare facilities that respondents are employed by. Again, the goal of this learning needs assessment was to evaluate and identify infection prevention and control training needs and gaps. So many of the assessment questions sought to capture information around frontline healthcare worker training needs and the respondents' capacity and confidence to implement infection prevention and control recommendations in the following topic areas: COVID-19, hand hygiene, personal protective equipment, source control, triage and screening, and environmental cleaning. The table on this slide summarizes the topic areas where respondents indicated a lack of confidence and ability to implement infection prevention and control recommendations. Environmental cleaning, COVID-19, and source control were the top 3 topic areas where respondents indicated an overall lack of confidence with their ability to implement recommendations. On the LNA, respondents were also asked to identify additional infection prevention and control training needs by topic. The 3 most commonly selected training topics include outbreak management, COVID-19, and sanitizing, disinfecting, and sterilizing. Similarly to the other slides, the table shown here summarizes the responses received around additional infection prevention and control training needs. The survey also included several questions around respondent preference for participating in trainings and receiving follow-up information from those trainings. We won't go into too much detail here, but this slide and the next slide outline those responses. Similarly to the last slide, this is a summary of responses about how respondents preferred to receive training and information. Through the learning needs assessment, we learned that educational opportunities should be delivered through online, interactive, computer-based learning platforms that allow attendees to interact with presenters and others on the line. Using the information from the learning needs assessment, you will see that this webinar series was designed to cover not only those topics where frontline healthcare workers indicated an overall lack of confidence and ability, but also covers those topic areas in which they indicated that additional training was needed, and of course, delivered in a way that meets their training needs. With that, I am going to turn it over to my colleague, Jenny Winkler, Director of Quality, Patient Safety, and Health Policy at the Illinois Health and Hospital Association.
All right, thank you, Christina. So we'll go ahead. I'm having a hard time moving our slide. So if you're able to just move to the next slide for me, Christina, we'll go ahead and we'll get started with today's, the second part of the webinar, really, where we're going to discuss mainly the concept of infection control and start talking about some of those infection control basics. Christina, can you move to the next slide? So real quickly, the next slide will highlight the learning objectives for today's session. And this is where we're really going to begin to start our discussion around the concept of infection control and how it relates to our day-to-day work. So as Christina kind of talked about, this session today is going to be more general in nature as far as infection control topics, but in future sessions, we're really going to get deeper into the details of infection control practices and talk more in specifics. So with that, we'll go ahead and jump right in. We're going to start just getting you thinking about, your role in your organization with just a couple of questions, to keep in your mind. So we want to start thinking about, why do we personally in our organizations do infection control? What do we think the goal of infection control is? What is the point of doing infection control and implementing a lot of these different practices? In just a moment, I'm going to play a brief video for you from Abby Carlson, who's an infectious disease physician at the Centers for Disease Control and Prevention, who really talks about this, why do we do infection control? And as we watch this video, I invite you to start thinking about, this question that's highlighted on the slide, and start to think about, so why do we do infection control? And we invite you to either share your thoughts about why you do infection control in your organization, or maybe just jot down some of those notes while you're sitting at your desk, because, all of us on the line here, we know that infection control is important for so many different reasons. So I'm going to go ahead and play this brief video for you, but just an IT, a technology thing. Participants that have dialed in on their phones using either their office phone or their cell phone to the WebEx session, in order to hear this video, you're going to have to turn the volume down on your phone and then make sure the computer speakers, your computer speakers are either not muted and that the volume is all the way up. And so that'll ensure that you're able to hear this video appropriately. If you have any questions, are having trouble hearing, feel free to chat, to send that in the chat box, and we'll help you try to troubleshoot that. And also, if we are running into issues with sound and you can't hear the video, we will be sure to share a link to the video following today's presentation. So you will be able to listen to this. So with that, bear with me for just a moment. I'm going to go ahead and get this up for us. So again, make sure your computer speakers are up, and then your phone volumes are down. So, all right, we'll go ahead and get started with our video. Okay. So I apologize if there were any technology issues. Again, we will send this video to everyone following today's presentation so that you do have a chance to hear about what Dr. Carlson was sharing. You know, she really just highlighted the importance of infection control, especially during COVID-19, when we know things were very stressful and challenging in healthcare, and still continue to be at times. So in a moment, what we're going to do is we're going to split up into breakout rooms to really talk about some of those things that Dr. Carlson mentioned, and then also talk through a handful of the questions that are laid out on this slide. So what we're going to talk through in our breakout rooms is, you know, why do we engage in infection control in our different organizations? And then again, highlighting, you know, as Dr. Carlson mentioned, we've had several challenges facing healthcare. Which one of these issues are most important to you, or which one of these have you experienced, and you know, share some of those challenges, especially related to COVID-19 and infection control in your organization. And then the third thing we'll talk through is, you know, what is one action that we can take in our organization to support infection control? So each of the breakout rooms is going to have a Project Firstline team member serving as a moderator, and we're going to have 15 minutes in each of our breakout rooms to discuss the questions that are highlighted on the slide. At the end of our discussion, we would like the groups to come back together and we'll share our answers to that last question, you know, some of those specific examples and actions that we can take in our organization to support infection control. We're going to ask that one person in each of the room take notes, and then after the 15 minutes, when we come back together, have them share, you know, some of those actions that we noted for that last question. Just want you all to keep in mind that there might be a variety of healthcare providers with varying levels of infection prevention experience that work in different types of facilities in your breakout rooms. So when we come back together in 15 minutes, we might have different examples of actions that people can take to support infection control in their facilities. And so we hope that as you know, you hear the discussion in your group and then you hear what some of these other groups share, that you're able to take some of these actions back and implement them in your own workplace. So with that, in just a moment, there will be a pop-up on your screen, and you'll need to click the join button to be added to a breakout room. So I think we can go ahead and launch those. Okay.
No.
Oh. Okay.
We're back to Jenny.
All right. It looks like everybody's coming back. So we'll give everyone just a moment to really, so I want to start by thanking you all. You know, those 15 minutes, they go by so very quickly. And I know that I'm sure all of you had lots of great discussion. So we really want to take, you know, these last few minutes today from our session to hear, you know, from each of the groups, some of those actions, you know, some of what you all talked about, and then encouraging you all as you're listening to some of the, you know, the sharing or the learnings from each of these groups' responses, you know, considering whether these are actions and things that you could implement in your organization as well. So I think, Christina, we'll go ahead and start off with you in group one and hear what you all talked about.
Yeah, I had, Kendall had volunteered to do my notes and do the report out for me. So I'm going to turn it over to Kendall if he's still willing to do that. But Bridget Jones, I want to say I'm sorry we didn't get to finish that conversation. Bridget is an IP at a correctional facility, and we lost, I really wanted to hear about that, and we lost the time. So I wanted to say, thank you. Kendall, do you want to go ahead and share our insights from the breakout one?
Yeah. Are you all able to hear me okay?
We can hear you, thank you.
Okay, cool. So we had two main speakers. We had Shannon, a nurse working in an ED/ER, and one of the ways that she engages in infection control is just around, you know, trying to avoid transmitting infections, things like that to patients, especially in that kind of setting. I think she mentioned that one of the challenges is that being in ED is often really fast-paced, and with the changes around COVID, you know, the extra control measures have meant that things are a little more time consuming. She mentioned donning and doffing, more, you know, more hand washing. And so that's been like a challenge that, you know, especially folks working in the EDs typically have or have had around COVID is, you know, trying to transport people in a timely manner, but also like making sure that you're being protective of yourself and then also of them. Especially, you know, before surgery, if surgery is needed. One recommendation she said is that, you know, just regular hand washing, you know, just could be improved in general. And I think that that's probably something that all of us recognize as something that has maybe fallen by the wayside, you know, in the 2.5 years since the pandemic started, but is probably something that's going to be ticked up in the next few years. And then we also had Natalie, who is an infection preventionist doing work around hospital-acquired infections or HAIs. And so she just, you know, mainly provides recommendations to both, you know, staff, and then I'm assuming hospital administrators around like, you know, how they can get the pieces together around managing infections, preventing infections. One challenge that she saw is that people are just really exhausted, right? This has been a really lengthy ordeal with, you know, managing infections and just maintaining kind of the high standards that infection control requires. And so, but she made, you know, a suggestion or a clear point too, that like, it's everyone's role to be an infection preventionist. It's not something that really is should just be the role of like two people, but everyone kind of has to have that mindset in order to manage and mitigate infections as they come up. And so she kind of encouraged folks to just speak up and take initiative if they see that you know, protocols aren't being like followed or followed well. Yeah, or you know, just in maybe a timely manner even. So she just kind of wanted to encourage folks that like that's one thing that could be taken away, is like, you know, you do have the power to be an infection preventionist. And so finding the ways that you can do that in your setting, in the ways that you're able, is like, you know, a step in the right direction, even if you're not necessarily sure that what you're doing is right, you know, so yeah.
Wonderful. Thank you guys for sharing. That was so great. Thank you for all those insights. I appreciate that. So going to our next group, our group was group number 2. You're a little shy, so I will share some of the things that we talked about. Our group had a variety of folks working in acute care, long-term acute care, local health departments, also partnering with child care. And so, you know, I think we highlighted a lot of what Kendall just shared. You know, COVID caused a lot of challenges. you know, especially with the changing of information. Building trust was something that was hard across all types of care settings, especially with changing guidance and people hearing information from different sources. You know, so some of the things we talked about was really encouraging community members to be proactive with their care, acknowledging, you know, when they're sick, you know, encouraging them to stay home, especially with children and child care. You know, when the vaccine's not available for children under the ages of 5, and also kids who don't wear masks very well. So yeah, so taking that proactive approach, you know, encouraging community, you know, people in the community to do hand hygiene, wearing your mask correctly. Those are things that we were talking about. And, you know, also that disappointment that it took us a whole pandemic to highlight the need for infection prevention and really showcase the importance that taking these infection control steps, you know, are necessary. And so that's a lot of what our group talked about. And so I appreciate everybody in our group who spoke up as well, and want to thank you all for sharing. So then going on to the next group, I think Alison, that was your group.
Yeah, thanks, Jenny. Hi, everyone. I'm Alison Van Dyne. I'm an infection prevention specialist at CDPH. I know my discussion group already got my little introduction, so I'll just quickly cover what we went over. There were a lot of great people who spoke up with different backgrounds. We had a lot of infection preventionists as well in healthcare and hospital settings, as well as some physicians, some nurses, and even some non-clinical support staff. We had someone who was very helpful in contributing from patient relations, actually. So one of a really good discussion point I wanted to bring up was just in terms of actions you can take to support infection control is education and streamlining communication. So we talked about in our group communications with not only staff and patients, but also families who are coming into these congregate settings, and making sure they're really aware of the changing guidelines and the importance of masking and hand hygiene. And then we did also have a great comment about reminding staff each day when you're rounding about hand hygiene and the importance of infection control topics that we kind of discussed. So there were a lot of great points that were brought up, and thank you everyone for sharing.
All right, Alison, thank you. Thank you so much for sharing. And then the last group, Shane, I think that was you guys.
It was us, yes, thank you. Hi everyone, my name is Shane Salencic. I'm a projects administrator and infection preventionist with the Chicago Department of Public Health. So our group had a lot of really great discussion. You know, we had some folks with infection prevention background, you know, some employee health folks and administrators, you know, in acute care hospitals, as well as some community health providers who shared a lot about, you know, obviously the focus of infection control is on patient safety, both in you know, sort of brick and mortar healthcare facilities, as well as those that are outside of that, you know, kind of across the spectrum of healthcare. And our group also expressed the importance of how, you know, infection prevention activities really do impact everyone, regardless of whether they're in the four walls of a facility, and how, you know, particularly in light of the COVID-19 pandemic, you know, it's important that we're all on the same page and kind of all working together. And, you know, in terms of challenges, I think we had some really interesting discussion that we hear a lot about in the health department about staffing being a challenge, you know, and being able to keep up with staff who may not be permanent staff in the facility, maybe agency staff or folks that are coming in, and kind of trying to keep them up to date on infection control practices, both, you know, best practices and those that are specific to the facility. As well as the supply chain being an issue. So again, I know we hear a lot about this in the health department side, but the group talked about how, you know, needing to get products was definitely a challenge, and needing to re-educate staff when new products were kind of being regularly brought in, and how that impacted their sort of infection control practice day to day. And in terms of what actions that we can take, I mean, I think a lot of it was sort of, or, you know, our conversation was around like grassroots efforts of passing along education, you know, among healthcare workers. So, you know, if you see something, say something, you know, help each other out, kind of address infection control concerns from, you know, as a group effort and a community effort, as well as, you know, the importance of behavioral change. So, you know, a lot of folks may know kind of what they're supposed to be doing from an infection control standpoint, but the challenge is just to kind of get people on board with doing it. And so we had some discussion around that as well.
Wonderful. Thanks, Shane, for sharing all that. And thank you all for participating in our discussion and really sharing, you know, some of the challenges you've experienced and, you know, some of the actions that you're taking. You know, 'cause this is really how we start to improve infection control in our organizations and then ultimately improve the safety for our patients and our community members. So with that, we'll go ahead these last few minutes, wrap up today's presentation. So just a couple of the key takeaways. This slide summarizes some of those key messages from today that really the goal of everything we do in infection control for any disease, you know, including COVID-19, but also any disease, is really to implement those different practices that keep our patients and our community members from getting sick. And so what you'll see throughout our webinar series really is that the goal of Project Firstline is to make sure that you have that knowledge to keep yourself, your patients, your colleagues, and your family members all safe. So just to highlight here a couple of the upcoming sessions, you'll see on the left-hand side, we have some more specific sessions coming up. And then there's the broader topics that are covered in the Project Firstline materials. There's a link to register for future webinars that you are welcome to pass along to your other colleagues in your organization. You know, as you can see, you know, from some of the information that was covered today, and a lot of these sessions are geared towards frontline healthcare workers. And so we encourage you to share these webinar opportunities with those staff members in your facilities as well. This slide just highlights some of those additional Project Firstline resources, you know, and we encourage you to explore these topics if you have any interest. We also have at the bottom here the website for the Chicago Department of Public Health. So you can find additional healthcare associated infection resources here. Also, while we will share the recording for today's webinar with everyone that registered, the recordings will be saved on the Chicago Department of Public Health's website as well. So we do want to thank you all for coming today to our first of 8 series. You know, if you have questions, comments, would like additional information on how to partner with the Project Firstline team, feel free to reach out to us here at Infection Prevention at team-iha.org. And then lastly, before you all sign off today, we would encourage you to complete the poll that's open on the right-hand side of your screen. The results from this poll will only be seen by the presenters, not shared with participants on the line, but the results from this poll will help us to improve our future education sessions. And then also for those of you that are seeking nursing continuing education credits, you are welcome to scan the QR code that's on the slide right now. And if you can, complete all of the information that's in the survey. If you don't have that information now and you're not able to complete the survey at this moment, we will be sending a link to everyone on the line, so you can complete the survey and get the nursing continuing education credit. So again, thank you all for your time today. We truly appreciate all of your efforts to keep your patients, colleagues, family members, community members safe, and we look forward to seeing you all at the next webinar. Thank you. Have a great afternoon.